Hey, this is Josh Nelson with Brain Train PT. I'm here to walk you through our brochure for concussion and a sports-related injury, our introductory guide to recovery. Here at Brain Train, we completely understand that there are different ways to learn, and we want to bring you to a different level by helping you learn in the way that works best for you. Some of us really excel by reading or seeing things visually. Others, by listening, we are able to comprehend and retain things better. And so in that way, we hope this audio can be beneficial to you. So I'm going to go ahead and share my screen for those of you who would like to follow along still. We are aware that there are others that are kinesthetic learners that like to do things. And in the future with PT, with your interventions, we're able to do those things with you and walk you through them and have you interact. And so that'll be a principle that we can apply with our future sessions as well. I'm just going to share this screen to show the pamphlet if you're interested in following along here. So we talked about the different type of learners on the back of the pamphlet here. Really, concussion, the difficulty with this kind of diagnosis is that it's unique presentation to each patient. I mean, really, it could have a number of different characteristics. And so the definition is a little difficult to define, but the American Academy of Neurology states that's a trauma-induced alteration in mental status that may or may not involve loss of consciousness. An interesting fact here that we included is that the research recently has shown that concussions that cause someone to become unconscious are actually having better long-term outcomes than individuals that don't go unconscious. So that may be counterintuitive to what you might think. So that's an interesting fact there about that. So the inside of the pamphlet here, what can you expect with the concussion? Are your symptoms consistent with what typical concussion patients present with? Where this can be kind of a bag of marbles and you can come with a lot of different symptoms. Here are some of the common ones that you can find. You may have headaches, decreased reaction time, memory problems, sensitivity to light and sound, mechanical issues, emotional well-being issues, and sleep issues. Those are some common things that you might find with concussion patients, or you might find in yourself if you've experienced this. So what can affect your recovery? Research has shown us younger age, history of migraines, learning disability, previous concussions, biological females, too much activity after concussions can affect recovery. So those are some of the factors that are involved. And a big disclaimer here, if you're in doubt of doing activity, if it could be harmful to you, if you're experiencing those symptoms, you need to sit it out. This is something that has to be moderated. Your activity has to be careful and it has to be planned. So really don't rush this process because you can cause further damage. And that's what physical therapy is here to help with. We're going to help you to set a program and help you to get back into your previous level of function. We're going to prevent any kind of cumulative effects to your condition. So any other kind of systems that could affect over time if you're pushing yourself too much or under pushing yourself. A lot of people that go through this have depressive-like symptoms, have these emotional problems that it can be accentuated with the lack of activity. So it's not something that should be avoided. We definitely need to have a good balance here. So balance is key. Every patient is unique, but we have to make a good balance of what we're doing with the activity that you're participating in. So the biggest things here, we're going to help you to not have the symptoms at post-concussion. We're going to help you get back and recover. And most importantly, that you're safe, that you don't take risks. And we don't want you starting sports or activity until you're ready to do so. And so that needs to be deemed by a medical professional. You need to be clear of the symptoms that you're experiencing. And research evidence shows us that physical therapy will help you to have the best outcomes possible. And that's what we're here for. So please call us if you have any questions. Information's here, our contact info. We're at 2222 Brain Damage Drive, Nystagmus County, Utah 84000. Our phone number is 801-766-1001. And we have a hyperlink here that will help you to access this at any point if you need to go over any of this information. But please contact us, and we look forward to working with you. Thank you.